Hello everyone, welcome to Instant Med. Today we're going to be talking about Anatomic Snuff Box. So there are four simple things to keep in mind about the Anatomic Snuff Box, which are boundaries, the floor, the contents, and the roof. Very simple and very easy concept to keep in mind. We are going to be starting with the boundaries. So there are only two boundaries. First of all, the anatomic snuff box is located on the posterior lateral surface of the dorsum of the hand. So as you can see here, this is the anatomic snuff box. As you can see, the depression on the posterior lateral side of the dorsum of my hand. So in order to indicate the lateral and the medial aspect of the hand, you can keep in mind the pollex, which is the thumb. It is going to be the lateral aspect of the hand, and the medial side ends with the little finger. So for the anatomic snuff box, there are two boundaries, one on the lateral side and the other on the medial side. On the lateral boundary of the anatomic snuff box, there are two tendons of two muscles. These are abductor pollicis longus on the extreme lateral aspect of the anatomic snuff box, and just next to it is the tendon of extensor pollicis brevis. And on the medial boundary, you can see this tight tendon of the extensor pollicis longus, which is quite visible in this video. And I'm also moving my thumb with this tendon. So these were the two boundaries. Next is the floor. There are four things to keep in mind for floor. These are the radial styloid process, the scaphoid bone, just above it is the trapezium bone, and the base of the first metacarpal bone. Keep in mind that oftentimes people do not consider the first metacarpal bone, or they would skip the radial styloid process, but these are actually the contents of the floor of anatomic snuff box. Moving on to the main contents of the anatomic snuff box, these are one artery, a vein, and a nerve. So it will be radial artery, then radial nerve, and cephalic vein. Then for the roof of the anatomic snuff box, it's simply the superficial fascia, this thin skin covering the anatomic snuff box. Now I want you guys to imagine this anatomic snuff box in this position. This is the position. This is going to be the styloid process of radius, the scaphoid bone, the trapezium, and the first metacarpal bone. Extensor pollicis longus on medial side, and two tendons on the lateral side.